Welcome to the Coming Home Well podcast, the show that educates, supports, and advocates for the veteran community. Your host, Dr. Tyler Pieron, U.S. Army retired, will bring you exciting conversations with amazing guests about resources, research, and military history, all geared to helping our warriors to come home well. Here's your host, Dr. Tyler Pieron.
Welcome back to Coming Home Well, Dr. Lawrence.
Hey, Tyler, it's great to be back with you. Yes, I'm honored to be back in the Trump administration, serving the president and also with Secretary Collins. So we're trying to do great things for our veterans again.
It's been about a year since the Trump administration came into office, and you've been serving America's veterans since last April as the Deputy Secretary of Veterans Affairs. I was glad to be able to go to your swearing in, even though that was my first time at the VA building, and it is definitely an interesting design. But that isn't your first time at the VA, having served as the Undersecretary for Benefits during the first Trump administration. Since rejoining the VA as the Deputy Secretary, what have been your priorities?
Certainly. Well, we've been following the Secretary. He's very clear. I mean, the president told him when he interviewed for the job, what shall he do? He said, take care of my veterans. And so everything we're focused on is around veterans. The Secretary talks about it as putting veterans at the center of everything we do. And from there, you build out. They want their benefits faster and more accurate. They want access to health care with choices based on where they are and how long it's taking. We have to deal with homeless veterans, veterans at the risk of suicide. So the Secretary has been very clear. We've been focused on timely delivery of benefits, timely care, and things related to that.
What are some of the things that have surprised you since coming back into the VA?
Yeah, we got here and noticed just a tremendous number of problems. I often wonder what the previous team was doing because it certainly wasn't focusing on veterans. Hence, that's why the Secretary is so focused on making sure veterans at the center of everything we do. They appear to have gotten distracted a lot. So we've had to deal with problems almost from day one, getting everyone to come back to work, for example. Getting rid of programs that really weren't on the agenda and that were not helpful to veterans. So we've had to deal with that. But the surprises were, probably not one of the surprises was how good a team there is here. Many of the faces I remember from before really drawn to the mission and were indifferent to the political shenanigans that went on, but many similarities. And again, some of the same challenges. For example, the backlog of claims, the number of claims over 125,000 days, over 125 days. I thought we had resolved that in the first Trump administration. We showed up as 265,000. The average day to complete was almost 5 months. So we had to deal with that. So this morning, happy to report, we're just bouncing under 100,000 and the average days to complete is 84 days. So you can see we really had to go back and retread a lot of ground.
84 days. That's amazing. Because actually that was my very first question I was going to ask you about the length of time that veterans have to put in for their claims. What systems and processes are being put into place to ensure that it all continues, so it's not just one administration and then it goes back like it has?
Yeah, well, we hope it doesn't go back, but that's a political answer. But we're really working hard to make sure we institutionalize the good management practices that had just been forgotten, as well as we're trying to bring some new technology to automate some of the things that take our employees just too long to do. So with new technology, as well as better management practices, we hope it doesn't go back.
Okay. So as we've talked about before in other segments, claim sharks. Let's talk about those for a minute. Those are people that are charging significant fees to quote unquote help veterans submit their claims outside of the accredited VA representative process. It's a real challenge, and a lot of veterans are getting hosed by these groups that are not really VA claims reps. What is the VA doing to help veterans with submitting those claims?
Yeah. So what we want to do is always, of course, encourage veterans to think real hard about who can help them at no cost, right? As you know, State Department of Veterans Affairs, the traditional veteran service organizations like American Legion, VFW, Wounded Warrior Project. So we want to remind them there are a whole host of places where you can get no cost assistance that really is very good. Many are accredited by us. We train them. They're very much aware of our processes. So we want them to be aware of that. However, both the Secretary and I are clear veterans have choices. So we understand they may, in fact, want to pay. We remind them of that. We like to point out that they should do their homework. to make sure they don't encounter what you're describing. Simultaneously, we are trying to really enhance the accreditation process to make sure that's more rigorous and we're more timely in doing that. So there'll be more to follow on that, Tyler.
Oh, that's really good news. Yeah, that's one of the areas that I hear quite a bit from veterans. Should I do this? Should I reach out? So let's talk a little bit about medical care. That's a huge issue for most veterans. I've had great care from the VA, and so I'm a big advocate for it, but there's always challenges. So medical care is often tied to paper records, especially for the folks that were serving for a long time. You'd have the scribbles on a piece of paper, and it makes it hard to properly document and coordinate care. What is the VA doing with electronic health records?
Well, that's the answer to the problem you just described, or at least that's what we've been saying since we figured this out back in 2017, I believe is when this started. But you're right. This is one of the things we imagine that a modern electronic health record system will do. It'll enable us to seamlessly transfer information from the service member to us at the VA. But more broadly, Tyler, this is really about bringing VA into the future and providing health care that's consistent where veterans are. We don't want to look back and use old tools and old technology. We want to bring VA medicine into the future. So the electronic health record will have access to the benefits the way you described. It's going to be better for our veterans, more time talking to the doctor instead of wondering if all the information is there. It'll be better for our doctors, less time searching for records and tests, and better for VA. All the information about all the veterans should encourage innovation and better collaboration. So we think it's really going to do a lot to increase the quality of care we provide.
So the electronic health records are both at the VA. Are they shared with the community care partners?
Yes, actually, that's one of the really great things about it is access to community care. In fact, you'll be happy to know I was in Lovell, the joint facility that the DoD and VA use, where we have the new electronic health record implemented. And I had a roundtable with veterans who are now receiving care from us using the electronic health record. And I asked them about it. And one of the things one of the veterans said was, it's so easy to have my records transferred into the community. I went to have, this is a true story, hernia surgery. They had all the records right there, all the x-rays or MRIs or whatever. And they said, gee, the doctor looked at it and said, you don't just need one hernia surgery, you actually need two, and I'll take care of that during our time together. So very powerful evidence of how it all works and how it should work going forward.
No, I'm a huge fan of the community care. The VA care is awesome, but sometimes it's too far away. And that's the reason for community care, or the waits are too long, or whatever the case is. And being able to push it to the community, especially if you have resources near you, it's fantastic for receiving medical care. What is the VA's approach to community care, and how might it be changing? I understand that there's some discussion about community care versus medical centers, or both.
Yeah, so we want to think about VA care has two components: the direct care, come to our hospitals, or community care. We want to think they're all VA care. And I think what we're focusing on just veterans' choice. What works best for you? As you point out, time, distance or time to travel, as well as time to get care. We think that's very important. We've just released an RFP, request for proposal, from industry to get more care. Part of that is around the ease by which it is administered and the ease by which it is available to our veterans. We are also very much aware, as you point out, Tyler, about where care is not available. Care into rural parts of our country isn't just a VA problem, it's a nationwide problem. So we're trying to figure out, how do we get more care to our veterans who live in those places as well. So we're really trying to up our game there and provide more options. So again, veterans have more choices.
You know, I've had an opportunity to interview the guy at the VA that started telehealth years and years ago, and it was fascinating how they did it. And this is prior to the age of the internet. They were laying T3 lines and direct things out to these rural clinics and community care, and it's only evolved since then. And so let's talk about telehealth for a minute. It's a great option for those that live in rural areas and where it doesn't make sense, where you have to physically go see the doctor for an in-person examination. Sometimes you do, that makes sense. What is the VA's view on telehealth, and how might it be evolving or being used more or less? Or what's the view on VA and telehealth?
Yeah, again, another choice for veterans. You're right. Some people find it very convenient. Others prefer to be in person and the like. We're aware that not every community in the United States can support telehealth, right? As you point out, how to lay lines. Again, back to our point about rural care. We just want to make sure the care is available in the way the veterans choose. That's really our perspective. And again, sometimes you have to come in, sometimes you can deal with it. So we're supportive of it, but it's just another one of the menu of how you can get your care from us.
So shifting gears a little bit, we had mentioned homelessness and those at the risk of being homeless. It's a real challenge, especially for folks that are just transitioning or towards the end of life, getting older and not having home. It's a really difficult problem and one the VA has worked really hard on for a number of years. I've talked to so many social workers, especially at the VA, who seem to be the spear at the tip of the spear of solving that problem.
Right.
What are some of the things the VA is doing to help veterans that are at risk of homelessness?
Well, this is one of Secretary Collins's top priorities. In fact, it's in his top 6, as we say. So this year, we're very proud to announce we've housed more homeless veterans in the last year ever in VA's history. It's almost 52,000 veterans. So it's very much a Secretary priority. It's very much something we're focused on. In fact, earlier this summer, I was at a homeless stand down where we're really trying to find folks who are homeless in the Washington, D.C. area and bring them into VA. As you know, I think I provided you the number before, the homeless hotline, 877-424-3838. If anyone who hears this number calls when you see someone with a sign or you think might be homeless, we will go and find out if they're a veteran and get them care. This is something we feel very strongly and passionately about. So, it is a full court press.
I was recently reading this whole story of this guy who was, it was live. It was him talking about how he was at risk of homeless and he was just despondent, ready to commit suicide. He just thought his life was over. Everything was horrible. And the community of veterans all said, hey, go reach out to the VA. And he posted a follow-up a couple days later, and they had done everything, including getting him into transitional housing, got him an ID, referred him to a job board, and he had a job within like 2 days. It was astounding to me, and it was just one of those good news stories that the resources are there and it works.
Yeah, and
So that was one of the things
yeah,
I was proud.
Yeah, that's fantastic. And let me pull 2 parts of your story out there that I want to highlight. First is, notice what you said, at risk of homelessness. You don't have to be homeless to reach out to us or call that number. If you think, hey, I'm at risk of homelessness. So if someone hears I have a buddy on the couch who's lost the job, that's the person we're talking, call us now. And the second thing you pointed out is exactly what we'll do. We'll help you get housing, but we provide in the industries that wraparound services. What else do you need? Help with employment, help with substance abuse, whatever it'll take to get you back on the path to pursue your American dream. It's exactly right. And so great to hear.
So let's talk about Congress and the laws. What are some of the things that are being implemented that Congress has passed to better help veterans across the entire spectrum of things that are new, that might be something interesting that veterans might not be aware of?
Probably the most recent legislation that I'm working on is what's called the Elizabeth Dole Act. You can imagine who it's named after. It was a whole series of things around better access for the veterans, more clarity on websites, more information to try to make the experience better. So that's something we're working on right now. By and large, we don't have particularly big agenda items on the forefront. They're watching over the implementation of the new electronic health record. A lot of stuff will go live again in 2026 as we sort of reset the pace and get going. So right now they have a lot of attention in that area.
So the electronic health records, a lot of these advancements, especially in getting benefits and health records and medical care, all seem to have a technological flavor to them. What are some of the things that are being implemented? You had talked about some of these new tools. I think it would be really interesting for folks to understand sort of what's going on behind the scenes that are making some of these dramatic changes.
Right. Well, definitely. So the new health record we've kind of talked about, that's a really big deal. Now it'll provide benefits to our doctors and hospitals, as I described. There's more technology to do what people do, only have it set up so we can do. So for example, as you know, because we've talked about it, veterans often have to have a C&P exam
Hmm.
compensation and pension exam to validate their disability claim. Well, if we have your medical record, we're exploring how technology can look at it so we don't have to have you do a C&P exam. We have heard the feedback on that, how difficult the C&P exams can be. So we can imagine a day in the future when there won't be C&P exams because we'll have your record online, and you might say, hey, I hurt my knee. There's an x-ray in there. Instead of searching for 1,000 pages by hand, AI will have found it and pulled it out and said, yep, you're absolutely right. Benefits awarded, and away we go. So we're really trying to think about things like that make the experience better. And with, for example, the new electronic health record, more modern technology will be available. So, for example, doctors don't like to write notes. No one likes to write notes. Well, now you can speak the notes, right? You can speak the notes. You can have AI search for information so that when I come to my appointment, you have it all in front of you. You don't have to hunt around. So there's really cool things like that that are making just what we do, quite frankly, better for the veterans. Easier to get your benefits, easier to get better care from us.
One of the things that is often discussed in the veteran spaces is changes to the schedule of rating disabilities. And there were some previous changes during the last administration. Sleep apnea, I think, was one of them, and some of the more common things. And honestly, the rules were written back in the 40s and 50s after World War II, and they largely haven't changed. Is there any appetite to changing that or advocating for that at the VA to more reflect the realities of, like TBIs are very difficult to rate, and they're usually rated really low, whereas sleep apnea is rated really high because back in the day you'd have to sleep in a hospital.
Right.
Is there any appetite to change them to sort of
Um,
modernize the
yeah,
schedule?
yeah, I think we have to be careful here, Tyler, because as you can imagine, the forces on the other side, every time we start to talk about benefits, they immediately start to say we're cutting benefits. And so I
Yeah.
spent most of my spring going to town halls and reminding people we are not cutting benefits, nor are we cutting healthcare. In fact, we're expanding care and we're processing benefits faster than ever. But the modernizing the process of looking at certain benefits is something we think about all the time, right? Because as you know, it's based on medicine. It's based on sort of how it affects your ability to work, right? Those things have
Hmm.
to be studied, and people come forward with different ideas that are socialized and done through rulemaking. So that's sort of going on all the time, but nothing really to announce or point out.
That's really good. That's going to put a lot of people at ease, just because there's always these rumors of this, that, and the other. And I was like, hey, it's a long time event. So, what are some of the biggest things that Secretary Collins and President Trump want to do in the next 3 years? It's only the first year of the administration to help veterans as they serve and as they leave service and throughout the years afterwards.
Certainly. Well, two things come to mind. Secretary is very much attuned to the processing of claims. He's very much aware of the backlog. So even though we were lowering it very, very significantly, he wants it lowered further, and he wants the average days to complete to be much faster, right? He understands, as a veteran himself, having served, talked to service members, what that means. So there's that challenge still exists. The second challenge is to make our hospitals work even better. Secretary just announced last week a reorganization of the Veterans Health Administration, streamlining the bureaucracy, removing a lot of the mid-level management layers that, quite frankly, got in the way. So he
Hmm.
wants the ability to make decisions, to be more agile, and that care to be better. So I think what you'll see in the next 3 years is a continued drive to what we call govern better, manage better, really provide the veterans the very best care they need. Yes, some of it's technology, but so much of it is how we as leaders and managers are more effective and getting folks there. So expect to see more of that as we roll out changes and, quite frankly, do common sense things. And I'll give you one example. Secretary was very clear. One of the first things he discovered was to women's care, if they wanted to get access to see their gynecologist, you had to get a referral, right? Well, this made no sense, right? He
Right.
immediately stopped that. So you'll start to see more common sense things about how we go about providing veterans care and benefits.
Now that makes perfect sense. So going back to benefits just for a moment, one of the biggest challenges is there's so many appeals and everybody fights at every point. And there's a well-deserved reputation for years and years where things weren't quite the way they used to be, or where they should be. And people would appeal at various levels, and it takes, I think we had talked at one point, like 5 years to get to the Board of Appeals, the actual courtroom. What is being done to sort of try to eliminate the need to do that, and
Right.
also to eliminate the or slow the number of people appealing, but also the time it takes to do an appeal?
Yeah. Well, don't forget, right? Appeals modernization in 2017, right, went into effect in 2019. So Trump administration, part one, right, implemented appeals modernization. So now you can appeal. You don't have to go to the board. You can go back to the Veterans Benefits Administration, ask for a higher level review, right? Another
Hmm.
set of eyes looks at it, or a supplemental review where you provide more evidence. Those work really well. So I'd encourage people to go there to deal with those, because you can often, find an error or present information, and you can have a conference so you can help the rater lock on what you think has been done wrong or inaccurate, right? But you can go to the Board of Veterans Appeals. That's still there. That's been modernized. There's 3 ways you can do that. It is taking much less than the 3 to 7 years, I think, back in the day prior to that. If you do ask to see a judge in person, I do think that can take about a year, but I might be off on that. And if you ask to see some of the things more quick, fast, in a hurry, there are some faster options. But appeal is one of those things that you do have the right to do at VA. I think we're unique as a government agency, and if that's what you want to do, you can. It doesn't cost you anything. It doesn't affect anything. And so we understand that. We've tried to study why people appeal, and it seems to be about the same percentage every year, somewhere between about 11 and 14% of the time people do it.
Wow.
It doesn't appear to be related to errors, though there are errors from time to time. It's just, hey, and I understand if you had your heart set on a certain rating for benefits, for example, and you didn't get it, I can imagine you sort of feel, I want to explore other opportunities. So you're right. Folks should be aware of it and understand what the possibility. It has gotten better, but it can be a tedious process.
No, it sounds like it. And I wasn't aware that it was quite so high. 11 to 14% seems to be a significant numbers. But I think part of it is that we've, over many years, said, oh, well, just keep appealing, keep appealing. There's no cost, there's no downside to doing that. And so high reward, low risk, you're going to get that behavior every time, right? So,
Yeah.
Paul, we've talked about a number of things. I know that the VA has so many things going on. What are some of the highlights that you want to leave the readers or the viewers with about what is the VA doing? What is the Trump administration doing to help veterans?
Yeah, I think I would go back to the secretary's priorities, because this really drives, right, putting veterans at the center of everything we do, really focusing on how do we help veterans, not the organization, not our personal agenda. Like, this is pretty powerful North Star, as people are prone to say. So from that, it was like, well, how do we get them care? So again, we've opened 25 new clinics since the year began. So we're
Oh,
really
wow.
trying, yeah, we're hiring doctors and nurses and providers to do that. So we're very focused on that, and a lot of things around it. The health record, for example, though that'll roll out more in 26, right? And again, timely access to benefits and care. Our veterans want their benefits processed quickly. We're on that, bringing new technology and, quite frankly, just better management. So you'll see us doing what we call the fundamentals. Yes, along the way, we'll make things better. We take the feedback about, we need better parking in our hospitals. Got it. We're working on that, right? We need to upgrade some of these because they're old. This year, I've gone to 2 celebrations in different hospitals of their 75th anniversary of the hospital, right? The history, the war ends, we come back and build hospitals, but they are
Boom.
old. And this is something, Congress is talking to us regularly about what will it take to modernize. So I think you'll see us doing the things veterans want: world-class healthcare, timely benefits.
The world-class healthcare, I just want to foot stomp a little bit because I am such a fan of the VA. My wife and I went to the Richmond VA. I had to have an MRI, and she thought it was just amazing. Just she had never been there, and she's a veteran herself. And I've recently got her to sign up for VA healthcare, and she had gone with me because I was having an MRI, and she was like, "Boy, this looks just like every other hospital." I'm like, "Yes, that's the point." And I just want to really foot stomp folks. Go check out your community-based healthcare. The VA has clinics everywhere. And unlike my local providers, I have local providers, but at the VA, I've had the same primary care doctor since 2009 when the VA clinic opened here in Charlottesville. Dr. Holmes is amazing, but to have the same health care, the same doctor for, gosh, I don't want to do math in public, but many years since 2009 is amazing. Whereas my community care changes every 6 months. So go check it out. And Dr. Lawrence, thank you so much for joining us on Coming Home Well. I know you've got a big job and a lot of things going on, and it's right before Christmas. And but I thank you for coming on Coming Home Well and really sharing everything the VA is doing to help veterans and make it better, faster, and more efficient to get the care and the benefits that we have earned.
Yeah. Hey, thank you so much, Tyler. It's great to see you again. I hope you'll invite me back again next year so I can tell you about the on-time deployment of the new electronic health record and what that means for our veterans.
You know, I've done a lot of research and talked to a lot of people about electronic health records, and it is such a foundational game changer towards good health care, especially for people in a mobile community, or if you move, you travel. Boom, they can pull it up, and not just the records, but the MRIs and the imagery and all the other things, which didn't really used to be the case. And it was really quite difficult. You'd have to redo everything. So, Dr. Lawrence, I leave you with the last thing. Anything you want to leave us as we head into the holidays?
No, first year of the Trump administration, we've accomplished pretty significant things for veterans in the first year. Stay tuned for some more stuff, and it's all focused on our veterans.
Thank you for joining us on Coming Home Well.
Thanks for joining us this week on Coming Home Well with Dr. Tyler Pieron. If you enjoyed this episode and you'd like to help support the podcast, please share it with others, post about it on social media, or leave a rating and a review. Thanks again. And until all are home and all are well, this is Coming Home Well.